right. Today on the Expect Miracles podcast, we have Dr. Darrell Misak, a naturopathic doctor out of Pittsburg, Pennsylvania. Doc, how are you today?
I'm blessed. And I hope you're doing well yourself.
Doing well, surviving the crazy times. I think everybody's doing the best they can. Absolute craziness, but everybody's hanging in there. Doc, where are you from originally?
I grew up in Bluefield, West Virginia, and ended up West Virginia University, got my pharmacy degree, went to Duke Medical Center, did clinical pharmacy there, found the pitfalls and where they're really not healing people, working with oncology and general medicine. Took my family across the country to Portland, Oregon to study naturopathic medicine at National College of Naturopathic Medicine, now National University of Natural Medicine. And I did compounding pharmacy while there while I was in Portland for 5 years. So
Doc, back up a second. You started out as a MD, medical doctor?
Nope. I started out as a pharmacist.
Pharmacist. Okay.
Yep. And then I went and got my naturopathic degree out in National College.
And what was it that made you make the switch over to naturopathic medicine?
Well, we all have our gifts, and mine is how to take things apart and fix them. And I've been doing it since I was a kid with toys or whatever. And then I got to school and I studied pharmacy, and I loved anatomy and physiology and biochemistry and how things work. Got to Duke and I watched people dying, and I'm like, why are we ignoring biochemical concerns with vitamin C depletion or vitamin B depletion? These people are falling apart. Their chemistry needs this stuff. And that led me to the works of like Ralph Moss, who does cancer research, and Julian Whitaker, these holistic kind of natural approaching medical doctors. And then I learned about, and Julian Whitaker mentioned these naturopathic doctors. I'm like, what the hell is that?
Yeah.
And I'm like, that makes sense, understand how the body works. But I took it a step further. Even in naturopathic medicine, you'll learn today that most talk about, hey, I've got a thyroid disorder, so you need tyrosine and phenylalanine and your conversion factors and superoxide dismutase and a little bit of copper and some iodine, and they're it's functional medicine from a standpoint of treating a disease, whereas I've taken it to the level of chemistry and looking at the energy aspects, a quantum aspect, and I call it bioelectric chemistry. And I've been teaching these concepts for the last 5-6 years at least, been practicing it for almost 10.
So what exactly is that? Because that's the first time I'm personally hearing about it. And how does it apply to people coming into your office and getting well?
Well, everything is energy. If you look at Einstein, he showed E = mc squared. Energy is the same thing as matter with the speed of light constant. So you are matter, which means your energy. It's the same thing. But energy in you is heat and electricity. And you break it down, it comes to positive and negative charges that dictate everything. And so you have cations, which are positively charged, and they are acidic in nature. And you have anions, which are negatively charged, and they are alkaline in nature. And there's a balance that needs to occur in the body. Well, Dr. Kerry Reams came about, and he created what's called he mathematically explained the theory of biological ionization, that we are electrical based beings. And he showed that the chemistry is dictated by minerals, because if you go back to ashes, you're 60% calcium, 24% phosphorus, 12% potassium, a bunch of trace minerals. And he showed that the minerals is what dictates our ability to utilize energy. So we need basic minerals, basic vitamins, and we use an equation based upon what your body's putting out: sugars, pH, nitrates, cell debris. And we explain that. So I've written articles in Naturopathic Doctor News and Review and things like that. They can be found. There's a website called docmisak.com. That people can learn more on those things. But the bottom line is I teach people how to eat and then what minerals that they need, because our soils are nutritionally depleted while we're in a toxic world and our bodies can't handle the stress load. So I basically show people how to gain more energy from their food, basic supplementation, and I watch miracles happen.
Absolutely. So it sounds like people come to you with all type of deficiencies, diseases, inflammations. It doesn't really matter what, quote unquote, the symptom is. You're not treating symptoms. You're treating almost, it sounds like, the root cause of the problem.
Right. I do I don't know if you've ever heard of EAV testing, electrodermal testing.
I haven't.
And we test people electrically because everything's electric. So you can measure acupuncture points. It's like electronic muscle testing. You
Nice.
find balanced electrical points, and then you stress them with frequencies where they've measured a frequency of a substance, whether it be a virus, bacteria, whether it be a food substance or an environmental toxin. And you introduce that frequency into your electrical system. And if it shortens it out measurably, Reinhard Voll figured this out in the 1950s. If it shortens it out, it's like a yes/no answer. Hey, you need to stay away from this. So we do that to test people for food and chemicals. Say, hey, this is bad for you. Stay away. I do live blood microscopy. Drop of blood, look at the blood, look at the health of the cells. Certain patterns in the blood suggest whether you're digesting appropriately, whether you have immune dysregulation, whether, you know, and so we can turn around and give you a visual picture of like, hey, your blood's looking crappy. And that's consistent with B12, folic acid, iron deficiency,
Right.
mold, stress, you know, parasitic issues. So we can turn around and see patterns that are consistent with various aspects. And then I look at the chemistry, the urine and the saliva. If you go to that docmisak.com, there's a little video whiteboard ad. It says analysis versus diagnosis. And it gives people, I don't diagnose anything.
Right.
I analyze and say, based upon this, this has to be happening. And here's the logical sequence of cause and effect that we need to do to correct it.
And so how do you balance out the correct amount of electricity in each person's body?
It's really comes down to removing stress from the body. You have to generate more energy than what you're consuming. So you have a threshold. And if you exceed that, your body says, I can't handle this. And so things start backing up. So when we reduce, you know, food chemical sensitivities and get those out of the diet, you know what I mean?
Yeah.
When you identify specific stressors and you help support the body to deal with that, it gets them lower. And when you give them the nutrients that they actually need to biochemically work, it kind of raises your threshold. Now I'm functioning here and I'm gaining more energy than what I'm consuming. So now the body naturally starts to detoxify. And when the chemistry shows that detoxification, we support it. I use infrared sauna. I do ionic foot baths. I got colon hydrotherapy. I have a hyperbaric chamber, and I use these things to augment, but I don't just push detox on people. You observe when they're ready to detox.
And what is I know the treatment definitely differs from each person to what they're coming in for, but generally, what's the time frame that you like to see people and keep a close eye on and then space out?
Initially, what I'm doing is I'm trying to get people, I do retreats where I have people come and stay for 3 to 4 days, and we feed them and we teach them how to do their own urine and saliva testing and how to eat based upon that.
Nice.
Because certain foods are anionic, certain foods are cationic, you know, acid or alkaline forming. And so we teach them how to eat and basic supplementation. But if people do their own testing, I have people from all over the country. They send me their numbers and we sit down based on height, weight, age. And right now I just wrote a book. I finished the book, and then we're coming out with a book and a workbook that says, here's the book that explains everything. And here's a workbook of how you can work through your own health. And we're in that phase of editing right now before we're going to release that type of information. Nobody's ever put it together that way. Is it the book published yet, or it's coming out? No, it's not published. It's in that editing kind of phase before we throw it to the publisher. So It's going to be called Health by the Numbers is what it's going to be called.
So Doc, it sounds like you have a great thriving practice out there in Pittsburgh. Why did you start making your own products and supplementation? Because you could have just stayed in your practice and just kept going elsewhere to get your products and giving it to your patients. How did you start your own line of products, and why?
There's a lot of reasons. You know, I mean, if you can look at a thriving practice, I can have a thriving practice where I can cater to the rich and elite and charge what medical doctors would charge for providing the same services.
That's a good point.
Or I can make my services affordable. So I make my services affordable, have 5 kids, and I get by like everybody, right? But it kind of a God thing. You know, in 2014, I learned about the 2009 Nobel Prize for Medicine and telomere activity. 3 physiologists basically discovered the enzyme telomerase. And as that enzyme is increased, it prevents the fraying of DNA. And DNA, these telomeres control cell replication. So there was a Hayflick. I don't know if you remembered in science and the Hayflick phenomena that cells would divide to a certain period to where they got to senescence, and they stopped dividing. And at that point, things that trigger senescence and that stopping at that dividing is inflammation. And now we sit here and say all disease is inflammation based, right? And so I could go energetically and talk about that, but I learned about this aspect of telomerase in 2014. So I just did a Google search, and I looked up medical research, all research on telomerase enzyme activity. And I printed out like 200 plus abstracts. There's over 100 pages. And I start flipping through them and I see all these natural products. And lo and behold, natural products have been shown to have this specific activity. And so I turned around and looked at these natural products, and then being the herbalist, you can see I mix herbs and things for people, from going to naturopathic medical school. I love, using herbs. And I turned around and said, hey, you can blend these herbs to affect multiple systems in the body and work as a holistic aspect. So if you go and you study telomerase activity, you'll find the very first product was this product called TA65. And if you take the recommended doses of what they have, it can cost you $3,000 to $4,000 a month.
Wow.
Massive. So this is what the rich and famous take,
Right.
And so that cycloastragenol and the astragaloside 4, astragaloside IV are these extracts from astragalus. Well, astragalus is adaptogenic. It helps the adrenals. It helps immune activity. It's been long use. It's for thousands of years, in regards to medicine and Chinese medicine and stuff. And then, so you got that as your base. And then you look at essential fatty acids. So I put the purslane in there, which is a weed that we pull out of our garden, but it's the richest source of omega-3 fatty acids. And that affects cell membranes and the ability of nutrients to go in and out of the cells.
What's this weed called?
Purslane.
Purslane.
Yep. Purslane's in your garden. You're pulling it out. I tell people pull it out of their garden and throw it in their salads,
Yeah.
And so you're affecting cell membranes. And then we have green tea in there. Green tea's powerful antioxidant. And if you look at most telomere products on the market, they're glorified multivitamins with a lot of antioxidant activity. Because if you really look at telomeres and what shortens them, it's crappy lifestyle, environmental toxicity, and stress. If people who just meditate and find themselves, meditation alone increases the length of your telomeres.
Wow.
It's amazing.
How long does it take for a telomere to repair itself?
The idea of the body is in restoration instead of repair.
Okay.
It's like get rid of the old,
Gotcha.
making new.
Gotcha.
So that's how the body works. So the idea is to support the body to eliminate the old while it has what it needs to make healthy new.
So it's repairing DNA.
Basically.
Wow.
We can't claim that, right?
Right.
So I put sambucus in there, resveratrol, again, immune boosting, antioxidant activity, ginkgo biloba. What does that do? Improves circulation to the brain. So blood flow to get that nutrients where they need to be and oxygen where it needs to be. Milk thistle. Milk thistle is shown, for liver across the board, but every one of these herbs has been shown to have telomerase activity. And then from a one that I had was another called Sinomorium. It's a Chinese yang tonic, and basically used for sexual vitality. Nice. And it really helps with energy, but it doesn't give you that wired feeling, And then from that bioelectric standpoint, I added trace amounts of calcium phosphate, because when you understand the electrical nature of us, and you learn in medical school, everything about EKGs, EEGs, EMGs, these studies of electrical activity in the body, and they teach you that it's all based upon calcium ion movement and stimulus through sodium and potassium gate channels and stuff like that. It's all mineral based. So calcium regulates all the minerals, what's allowed to go in and out of the cell. So a little bit of calcium phosphate in here, and then I put lemon in. Again, lemon has vitamin C. Lemon's strongly alkalizing to the body, but lemon is a 100% anionic substance, so it disperses. If you remember that commercial, Dawn takes grease out of your way. The grease is all cationic and clumping, and soap is an anionic surfactant. One drop, boom, dispersion. So we put the lemon in there to disperse, and we actually encourage people to, when they take the supplement, to drink it with a little bit of lemon in their water.
Really?
Yeah. And so what you're doing is you're dispersing. So you're working on this whole body system. And so what we find is people are raving like energy and mental focus. And if you look at the study in 2009, the rats that they reverse engineered, their brains grew 25%. Their hair went back to dark. Their kidneys restored, cataracts removed, their muscle strength returned. They had ability to go through mazes and stuff like that again. And so we're hearing miracle stories, but we can't claim them. You know, so if you go back, we're working on like Facebook and social media for people to put their testimonies, but we have people with their hair growing out dark. We have people with their hair coming back in. We have people in their 70s that said their sex life is restored. And it's just, for me, it's mental focus, it's energy. And in these times, it's immune based. You got Sambucus, you have astragalus in there, and reduce the stress on the body with the antioxidant nature of the green tea. So it's just overall, you know, it's just one of those feel good products, but the science behind why we created it is all based upon telomeres and the aspects of this eclectic nature of let's get these systems to work and be supported efficiently.
Absolutely. So Doc, is this the product you're talking about that you just sent me?
Correct. Vitalometry.
So how does it work? Does somebody need to have a consultation with you to know what to take and how much to take? What if somebody just picks it up and wants to use it for themselves?
Yeah, it definitely. We formulated both a 30 count bottle as a trial size for people, and the original was a 120 count bottle. When I formulated this product, I made sure that there's no ingredient in there that if you take more than up to 12 of them in a day, that you're not going to exceed any recommended dose for anything that's in there. And so I formulated it to where I take 4 in the morning, and then in the afternoon, if I'm feeling run down, I'll take 3 or 4 more. Nice. But most people, like when you're looking at a $90 price tag, you know, and that $3 a day, which is less than what most people are spending on coffee, they're like, I don't know if I want to try that. So we came out with that 30 count bottle for people to try. And what we found though, is most people can get by with 4 a day, 2 in the morning, 2 in the afternoon, or just 4 all taken in the morning. And we're just hearing just these wonderful reports. We tried to send that to you last week for you to be taking it for the week.
I got it yesterday.
Oh my God,
I got it yesterday. I've had a couple random packages of supplements show up to my door, and I've been a little bit skeptical. I knew where this one was coming from, but I got it yesterday. So I wanted to pick your brain about it first before I tried it.
Yeah, we have had, I mean, when people ask, the main question that people have is, does it interact with my drugs? And so because of ginkgo being in there, ginkgo and purslane, essential fatty acids, they can thin platelets. So if you're on a blood thinner, I've taught medical doctors and as from a pharmacy perspective about drug nutrient herbal interactions. And the thing is don't fear the interaction, be aware of the interaction, because they'll give people the Tyclid or, you know, the warfarin and aspirin and things like that interact, and they know about it, right? And so they monitor. So if you introduce something that can, because ginkgo can inhibit platelet activating factor, and both with essential fatty acids, omega-3 fats can decrease platelet aggregation. So therefore, hey, I might bleed a little or more if I'm on a blood thinner. It doesn't mean that you're going to have an open bleed, but if you start bruising, oh my God, then you should adjust. Does that make sense?
Absolutely.
So, but don't go in and take full strength. Start with 1, watch for bruising, those type of things. If people are monitoring their INR, see if it varies. It makes sense. But other than that, we haven't seen any nutrient drug interactions. We have one person who has sent the product back because after they started taking it, they started to develop where their immune, I think what happened was they were supporting their immune response, and they started reacting to food when they were eating it, because I think it enhanced their innate immunity, and their body saying, hey, you're eating crap, you know?
Yeah.
But
well, you see that with a lot of any great healing products, healing treatments, that sometimes you get these flare-ups because the body is just trying to get rid of everything that's been toxic.
I agree.
So Doc, the $1 million question with any product is, how long should I wait until I feel something?
I mean, we just did a third party kind of thing with Kathy Ireland, and they recorded, and they came in and recorded, and we're going to be having a video that's going to show up in regards where it's in final editing and stuff. And we had a patient testimony where she just came in and was going to give her testimony in regards to taking the product after, and she's like, the very first day.
Nice.
And we've seen that multiple times. People take it, they'll take 4 and they'll be like, holy crap, I'm not tired. What's going on here? You know, and, or, you know, hey, honey, you know, what's going on tonight? And so we have had people the very first day notice a change if they take 4 that first day. So, but that's why the 7, you know, the 30 capsule bottle is so people can sit here for $28.95 and try it out and say, wait a minute. Yeah. Usually within 2 to 3 days, people are like, okay, there's definitely something going on here.
Beautiful. And is it better to take with or without food?
I have found that it doesn't matter.
Nice.
You know, typically, if something upsets your stomach, you take it with food. The small amount of calcium phosphate that's in there is not affecting. And I personally, I just pop 4 whenever, you know, and
Beautiful.
so I have not found that it makes a difference with or without food.
And so is this, do you have multiple products, or is this the golden ticket right here?
Right. Golden ticket. I like that.
Yeah.
I mean, because if you look at the big picture, you know, I'm working on developing a nonprofit to put retreat centers and train people in understanding this bioelectric concept, and setting retreat centers around the United States where people can come and learn and and start practicing, hey, seeing restorative medicine at its best. And so I've always like, God, why'd you put me in this position? That's like an incredible thing. That's going to take millions of dollars. Where's that coming from? And all of a sudden, this concept came in 2014, 2015. I started right here mixing up herbs and making them so they fit in the capsules. And then I started experimenting on myself and be like, oh man, do I really feel this? And I started asking, you want to try this? You know, and people were like, okay, I'll be your guinea pig. And then everybody that tried it came back and like, can I get more of that? So right now it's the one product.
And it sounds like it's pretty unique. Not many people have anything similar to this on the market.
There is, if you look at all the products for telomerase activity, 90% of them are based upon like a basic multi and antioxidant. And they're basically a glorified. You will see that astragaloside IV or astragaloside 4. I don't know which they go by. And the cycloastragenol in products. But that cycloastragenol is $26,000 a kilo. So that's why there's such a small amount in it. You know, and so if you take up to 12 of them, then you're getting like the dose near what that TA65 would be giving you. But then if you're buying 3 bottles, that's also what, $270 a month supply to do that.
Yeah.
You know, and you don't need to do it.
What's the price on this?
Statistically, I'm sorry.
What's the price on this?
The one that the 30 count bottle is $28.95.
Beautiful.
And the 120 count bottle is $89.95. Now we set up, because we're doing this show with you, that if people use your last name as in the discount code PECCA, right? Okay, that they'll get 10% off at checkout. So if they go to docmisak.com, they can learn about me. If they click on Vitalometry right there, and when they're checking out, use PECCA, they're going to get 10% off of that product. And so they'll pay whatever $89.95 minus 10% is.
Beautiful. And Doc, you kind of mentioned this before, but is there anything else that you can take this with to enhance the product? I know you mentioned lemon juice. Or
I use
lemon water.
I usually use a ratio of about 1 ounce of lemon to 9 ounces of distilled water. And I'll actually have people drink about 3 ounces after every meal, you know? So just if you're taking that, you know, a wedge or 2 of lemon and a small amount of water, lemon disperses. Lemon is anionic. And so you're dispersing, and it helps normalize pH of the bile and strengthen the bile quality. Whenever we're looking at energy, it's heat and electrical energy. And heat is based upon the friction and the resistance of molecules moving across one another. And so when you do that anionic dispersion, you're getting anions and cations creating, and so you're going to gain more energy both from food and from the supplement. So that's the main thing that we have people do. When you're asking about if there's any other product, I'm in formulation right now for a product that I'm going to call Moldies, because
what is it?
Moldies.
Moldies.
Okay. MOLDEZE. Because when I'm going and looking at chemistry, I find so many people are dealing with chronic mold issues, where if they've had massive mold exposure, 90 to 95% have it growing in their sinuses. So you got to be on some type of sinus program. But if you go and look at the agricultural, their livestock industry, you'll see that our beef and chicken and pork, which you shouldn't consume anyway, pork, but our animals and even marine life are fed herbs and given clay and charcoal binders to minimize the mycotoxin exposure that they are, because it affects their fertility, it affects their well-being, it affects their kidney function, it affects cancer formation. Mycotoxins are rampant in our society.
And these are being fed to pigs a lot?
Say that again?
Is this being, you said stay away from pork?
Yeah, if you're looking at a chemistry standpoint, pork, shellfish, and tuna mess up everybody's chemistry.
Really?
Yeah, it's just.
Fuck. I had pork, I think last night, and tuna 2 days ago for lunch.
And I bet you have not felt very good. You don't sleep as well. You're probably waking up to pee at night. You're probably finding that your mental focus is being.
That last statement rings true. I've been waking up a little bit, going to the bathroom.
Yep.
Yeah.
Your body has trying to say, hey, I got to get rid of this.
Interesting. Wow.
So basically, when I run somebody's chemistry, I don't even look at their intake form. So most people, you got someone come to you and you look at, you've got dizziness and you have fatigue and you have joint pain. I look at none of that. I run a set of numbers on people. I test them. I look at their blood and I tell them all the symptoms that they're probably having. And they're like, oh my God, how do you know this? I didn't even put that in my chart, and it's just because the chemistry dictates what happens in the body.
Very interesting. Very cool too. So Doc, where can people find you online, the products, your practice? Where's everything at?
The easiest way is docmisak.com, DOC, Misak, MISAK.com. And that has a link to all the above, so
Beautiful.
We're linking everything on that one website. I do a YouTube show every Saturday morning. Unfortunately, I think I'm a little shadow banned, because if you go and search me, you won't find me.
Not surprised.
Yep. So I teach people to equip you how to test at home, how to understand what you need to do to be healthy. And it's life transformation. It really is. Everybody can be healthy. And if you actually test yourself, there's no greater way to show love to yourself than understand, like, oh my God, if I eat that, I feel like crap. And it's showing me that I am. So if I just try to learn to understand these numbers in a simplistic aspect with what I'm eating and drinking, I can take care of myself and live a healthy life.
Absolutely.
It's not in a product, it's in a process.
Absolutely. And Doc, at the end of every show, I like to ask all my guests, what is one piece of advice that has really resonated with you over the years that you would like to gift the audience? Could be absolutely anything.
One piece of advice. Wow, that's a loaded question.
Very loaded gun question.
I try to provide that with so many things. I mean, I'm going to tell you to find you.
Yeah.
Who are you?
Yeah.
Because self-awareness and understanding, when you start becoming aware of the symptoms in your body and say, hey, something's wrong. If you're really aware and loving yourself, you're going to look for why. If you understand who you are, you're going to understand your limits or how you could overcome those limits. So if there's one aspect of advice, is to understand yourself, is self-awareness, because we are all caught up in all this emotional crap and stuff. And most of us are not taught healthy emotional responses. And we live in these emotions and in a very unhealthy way that affects how we interact with anybody around us or whatever else. Whereas in reality, we should say, look, you're as broken as I am, but I'm going to accept you and I'm not going to hold that against you. But where we are, let's move forward.
Absolutely. I love it. Doc, thank you so much for coming on the show. Very excited to try the product out. And anybody that's listening can use the promo code PECCA, PECCA, for 10% off.
Yep, 10% off at checkout. Just put it in the discount.
Beautiful. Doc, thank you so much. Thanks for taking the time. Be well, be safe out there. And I'd love to have you back anytime.
Thank you very much. Appreciate it.
Absolutely.